Hi, I'm Mark, a member Cancer Friends of Hope organization. We at Cancer Friends of Hope acknowledge that there exists an equity gap in the cancer care program. People who seek cancer care hit barriers at every turn: income, education, geographical location, and discrimination based on ethnicity, race, gender, sexual orientation, age, disability, and lifestyle are just but a few of the factors that can negatively affect cancer care program. The most disadvantaged groups are also more likely to have increased exposures to a host of other risk factors like tobacco, unhealthful diets, and environmental hazards. Many studies focusing on the need assessment for patients with cancer have shown that an average of 32% of cancer patients report the need for psychosocial care, covering a wide range of various psychosocial needs. You see, most commonly reported needs include help with coping with anxiety, depression, and the fear of recurrence or progression, help with better communication, and support for relatives, families, or spouses. Although psychosocial needs of cancer patients are well documented in literature, there still exists a serious barrier to the delivery of psychosocial care for cancer patients. A need assessment in psycho-oncology is estimated to be a complicated task due to the various influencing factors. You see, patients often get support from their families or friends and have no clear information as to what to expect from psychosocial interventions. They feel ashamed and may also feel or fear that disclosing their feelings may impair their emotional status. A recently published review showed that the most commonly perceived barrier from the patient's perspective is related to receiving adequate support from elsewhere and a lack of perceived need for specific psychosocial care. Another barrier is referring to clear and appropriate information about psychosocial services and knowledge about what types of psychosocial interventions could be helpful. For the patients, the role of psychosocial care in addition to existing medical support still remains often unclear. You see, you might feel like the equity gap doesn't impact you personally, but it likely does affect someone you know. While it's more pronounced in low and middle income countries like our country Kenya, well-resourced countries show dramatic disparities too. It is almost guaranteed that the gap affects you or the people in your community. So, be the voice, take action, and close the gap as you join our organization, Cancer Friends of Hope, to close the gap.